Hi, everybody. My name is Anna Lee Cawthorn. I'm with the Tennessee Commission on Aging and Disability. We serve as your state unit on aging, and we also provide administrative support to the State Palliative Care and Quality of Life Advisory Council. I'm very excited today to introduce our speaker for the Referral Etiquette Team Dynamics webinar. We have with us Dr. Clay Jackson. He's the Clinical Assistant Professor of Family Medicine and Psychiatry at the University of Tennessee College of Medicine in Memphis, where he maintains a private practice in family medicine and directs the palliative medicine program at the West Cancer Center. Dr. Jackson also serves as the Associate Fellowship Director for Palliative Medicine at the University of Tennessee College of Medicine. From this professional platform, he leads multiple teams of dedicated clinicians who have helped to transform the experience of seriously ill patients in the Mid-South. And Dr. Jackson also serves on the advisory council for us. Dr. Jackson, I'll turn it over to you. Thank you so much.
Thank you, Anna. Thanks for the fantastic support. Anything goes awry, it's my fault, not yours. Everybody, it's a little bit of a hodgepodge today, how teams function, but also a little bit about how to set up a referral consultation service and sort of how to behave in the inpatient setting or the outpatient setting vis-a-vis referrals from our colleagues, either in primary care or other subspecialties. So basically one slide only on a referral service, and we'll do a lot more about team dynamics. A referral service really has a lot to do with how you behave as a clinician. A team is more about how you behave as a leader. And there's basically 4 A's of building a consultation service. And number 1 is being available. And then number 2 is being affable. Number 3 is being able. And number 4 is being accountable. And of these 4, I'll tell you that most seasoned clinicians will share with you that being affable is probably the most important one. If you are not a nice person, people generally don't like to deal with you. That will work if you are the world's best robotic colorectal surgeon and you can do procedures that no one else in your catchment area can do. Our procedure is communication and empathy. And so if you are not affable and approachable as a palliative care clinician, you're going to suffer. And your teams are going to suffer because you're not going to be very popular in terms of your colleagues, and they're just not going to use you because, frankly, you're going to be more trouble than you're worth. You would be like a surgeon who leaves bleeding arteries or doesn't sew up patients properly or leaves sponges inside people, because if you can't communicate properly and be available in real time, then these complex issues that we deal with, you're just going to cause more problems and more landmines. People are coming to you in palliative care to consolidate complexity. They want you to be the narrow end of the funnel of very complex communicative and decisional support and pain, symptom management issues, and they want you to sort of be the complexity eater, and to chew all that up and to spit out things that are fairly straightforward for the patient and the family. And so that's kind of what we do. So availability, make it very clear from the beginning how you're to be reached. If you have an answering service, fine. Nobody cares a beeper anymore. Most people have cell phones. I would say that for the nursing staff, if you're dealing in an inpatient or an outpatient environment, for clinicians, cell phone availability is give out your cell number, and I probably put it on your business card. If you find, I mean, whether or not you give your cell number to your patients is your business. I would be circumspect about that, but I will tell you that with respect to calling after hours, I find most patients to be quite respectful and to really protect your boundaries. Very few of my patients call with clinical problems unless they really need it. So be available. If you're in an inpatient environment, the doctor's lounge is your best friend. You want to hang out, you want to see people. Even if you don't have a patient to see, you might want to do your work on the wards. If you have admin work, if you have emails to answer, et cetera, you might want to find a physician's workstation and just sit there and do your work that you might ordinarily do in your admin office, in order that you've got FaceTime, the generic FaceTime, not the program on your iPhone, but that you have the ability to be seen in the inpatient environment, because people see you, they're going to think about you, and they're going to use you. Oh, hey, I've got a patient. Affability, be nice to people. We've already gone over that a little bit. When you're starting a service, it's not the time to sort of, I mean, personal boundaries are personal boundaries. Don't endure harassment, but it's not the time to say, I don't take that patient, or I don't deal with that kind of patient. When you start a service, you're going to get everybody's worst case, and you're going to get the patients that nobody else wants to deal with, the families that drive everybody crazy. And you have to show that you can handle that. And then you'll start to get the middle of the curve, the Gaussian distribution curve, in terms of your bread and butter consults for what you're doing. And of course, tough decisions, tough symptoms are what we manage in palliative care, but you're going to only get a lot of crazy stuff in the beginning, and that's fine. After you've had an established service and you know what you want to do and what you don't want to do, what you're comfortable with, and your roles established, then you can sort of, shape your practice to be what you want it to be. You have to have a practice to shape a practice. So don't start by denying patients. You'll get to be known as the doctor who doesn't want to do anything. Dirty little secret that nobody talks about: palliative medicine is thought of by some internists and some intensivists as a specialty for people who don't want to be busy, and the specialty for people who don't want to see a lot of patients. Obviously we have more complex conversations, and so it's not appropriate for us to be seeing 30, 40 patients in a 24-hour period. But just because you're seeing 10 to 12 a day doesn't mean that you shouldn't be, putting forth a good effort. And so if you start by denying patients, or by saying, no, I don't want to deal with this, I don't want to deal with that, once you develop that reputation, it's very hard to shake. So I would say, be available, be nice, take patients, and then once you've built your practice, then you can say, hey, this is more chronic, or this is more psychiatry, this is more, don't handle in clinical situations that you shouldn't handle, you're not trained for. But in terms of your preference, let your preferences be known after your practice is built, not on the front end, because you'll suffer. Once you develop a reputation for being lazy or for being hard to deal with, that is very, very hard to shake. Remember how you are in your social life. First impressions are very difficult to overcome, and we each have a first impression when someone walks in the room. That's why we have certain standards of professional dress. It's why we have certain standards of social comportment. It's true in medicine as well. And one of the first things that consulting physicians are looking for you as a consultant is to see whether you'll take tough cases and deal with it and make life easier for them and for their patients and families. If you do that, you'll have plenty of business. You won't have to buy a billboard. You don't know how to do that, there aren't enough billboards to save you. And you're not going to do well. You'll have a 1-year contract everywhere you go, and your kids won't be able to go to private school. All right, ability. You need to know what you're doing. If you train a good program, if you keep up, if you read, then you're going to be fine. Again, in this business, it's not about, whether you can tease off the trigeminal nerve from, where it grows out of the fossa in the brain. You need to know how to communicate. You need to know how to relate to people. You need to know how to have rapport. Practice it. There are certain ways of sitting. There are certain ways of standing. There's certain ways of touching someone between the shoulder and the elbow. There's certain ways of expressing empathy that are they're universal. They're available, and you can learn how to do it. You can learn how to communicate better. Challenge yourself. Be observed. And then when it comes to the technical pharmacologic management, there's no reason you can't be an expert. And so do that. But again, if you do right, nobody's going to care what you scored on your boards. What you scored on your boards doesn't make a hill of beans. It just doesn't. By the way, in terms of malpractice litigation, board scores don't correlate, and outcomes don't correlate with malpractice litigation. You're going to be dealing with some very complex patients. If you want to be on the right side of litigation, make sure that you have the first two. Talk to people and be nice. Doesn't mean you have to bend over or break your boundaries, but just, be a human being. Don't be fill in the blank with your negative epithet. Just don't be nasty. And then accountability. If you forget to see a patient, own up to it. If you forget to call somebody, own up to it. If if you make a promise, yeah, I'll come back and see that patient for you today. Well, you get your tail end up off the dinner table when you're done and go back and see that patient. Do what you say you're going to do. Because again, if you get to be known for somebody who says something, if you promise yes, follow through with yes, in order that your consultants can rely on you. If they can rely on you to do what you say, that's going to go a long way. And if you say, look, I seen 18 today, I can't see him today. Will tomorrow be okay? People will trust that a lot more than if you say, sure, I'll take care of it. And then they get back the next morning, the family says, we haven't seen anybody. That doesn't play well. All right, that's enough about how to establish a service. It's mid-career pontification from me, but that's 24 years of experience, and I've built services in 7 hospitals and 2 outpatient clinics. So I get 1 hospice residence, 1. I don't know. I think I built somewhere between 10 and 12 services into 24 years. And though there are no secrets, that's it. That's all. If you do that, you're going to be okay. All right, so let's talk about teams for a moment. There are all kinds of 4-quadrant systems. There's the DISC system. There's Myers-Briggs. You can find this kind of material anywhere. Pat, if you've been involved in any mid-size or large corporation, you've probably done personal training to learn about what your personality type is. This is adapted from the Sin Delaney program, Larry Sin and Delaney. This is basically correlated along whether you're formal or informal, whether you're associated with task and accomplishment, or whether you're associated with people and togetherness, and then whether you're laid back or whether you're a take charge kind of person. And so the formal people who are take charge, they're the doers or controllers. They want control over their schedule. They want control over their lifestyle. They want control over their income, and they don't want you to tell them how great they are. They don't want to be patted on the back. They don't want an old watch at the end of their 40 years. They just want control over their life. The opposite diagonal of that is the people who are laid back and they're informal and they're about people and togetherness. Those are helper supporters, and those folks, feedback is incredibly important to them. They don't value control so much as they value everybody being on the same page. In the upper right-hand corner, you've got your detailers, your analysts, these are your accountants. These are the CFO types. They're the people whose dreams at night involve very large Excel spreadsheets with complicated formulae. And those kind of folks, they're ready, aim, 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 aim. When was the last time I calibrated this? And then fire. So that's the upper right quadrant people. And then the lower right quadrant, you've got the people that drive those people nuts. And that's folks like me, promoter visionaries, ready, fire, and then what were we aiming at, and all of that. So, never met an idea they didn't love. Everything's going to be great. Glass is not only half full, we got a whole case of glasses, and let's just have a party. And these are people who tend to be evangelists or promoters or salespersons, or they're very enthusiastic and sometimes right, but most of all just enthusiastic. So knowing those people and how they are on your team kind of helps you to organize who the players are. Now let's talk about how the team works together. These are questions to ask regarding your team. Do we make decisions unselfishly for the greater good of the organization, or do we tend to act in our own self-interest? Is our team seen by others as being aligned? Do we assume best intentions in one another, or do we jump conclusions about motivations, especially when we disagree? This is a core question about your team. How do you fill in the gaps? If your team fills in the gaps with bad stuff, you need to retreat because you need to do some trust falls or something. You've got to trust your team. Is the interesting part of your team the meetings or the water cooler after the meetings? If it's the water cooler after the meetings, you don't have a team. You have a group of people that are in the same room. If conflict doesn't happen in the meetings, listen, every team has conflict. I'm in a marriage, we got conflict, right? But if the conflict is unspoken in the meeting, it means people don't trust one another, and so they just carry that conflict out. That's a real problem, because if meetings are boring, doesn't mean your team is boring. It just means that interesting stuff is happening somewhere else. once people get lubricated with the water cooler or something stronger. When a decision made, does everybody own the decision and do they fully support it outside the meeting room? That's a corollary to the previous question. Do we walk the talk by living our values with integrity? Everybody's got an eagle on the wall with the motivational thing underneath it, but what you live is actually what matters. Are we acutely aware of the impact that our shadows cast? When you're bad mouthing your CEO, do you realize that that casts a shadow and people will bad mouth you when they leave your presence? Do we fully participate or do we just give the nod and go on? Craig Greschel is a religious leader. He said, how your team thinks, acts, and leads a combination of what you've created and what you've allowed. If you don't like what you have, change what you expect and what you accept. And then you'll see that things change. If you don't like people being late to meetings, just start the meetings on time. They'll figure it out. The third time somebody walks in 15 minutes late and you're already done, they'll figure it out. If you keep waiting on them, they'll never come on time. All right, so what are the 5 conflicts of team? This is from Frank Lencioni. There's 100,000 leadership groups. You can waterboard yourself with them and knock yourself out. But I really like Lencioni's work. It is the most applicable that I've found to team dynamics. The 5 dysfunctions, and they build on one another. Absence of trust. Don't trust one another, then you fear conflict. Because if you don't trust, then when you have conflict, that means the relationship's broken. When people don't trust one another, they learn that conflict is a reason for people to go rather than to grow. So if Anna Lee doesn't trust me, then she's not going to tell me, I'm really ripped off that we started this presentation an hour than you said, and don't ever do that again because it messed up my schedule and I was late picking up my kids. That's a real relationship because she could really tell me that. Anna Lee and I do happen to value each other enough that if she said that, I would say, okay. And I'm not worried that Anna Lee is going to say, I want Clay kicked off the board because he sucks. I understand that we have a valued relationship and she can be honest with me if she wants to. Now, she's very kind, so she'd probably never do that anyway. But the point is, if we trust each other, we can afford to have conflict. Trust is the capital that you have that you get to spend when you have conflict. If you fear conflict, then you have a lack of commitment. If I'm ripped off at Anna Lee, the way she managed the last meeting and I didn't get to show my wonderful presentation because she ignored me on the agenda and I don't confront her about that, then I don't want to come to the next meeting because I didn't trust her. So then didn't want to have the conflict. And now I'm not committed to the team because my voice didn't get heard. So when we don't trust, we don't fight. And if we don't fight, then we don't stick together. That leads to avoidance accountability. So I just start ignoring emails from Anna Lee about the next meetings because I don't want to come. I don't come. And then finally, nobody cares about results. Everybody just focuses on consciousness raising and let's all get together and have drinks and pretend that we're doing good work. And this really, really affects nonprofits, and we have to be careful about that. Governments are usually held to some standard of accountability by the public, at least every 2 to 4 years. But nonprofit teams can be pretty bad about this. And so watch that. Palliative care, if you sell your CEO, you can't measure us on E&M charges. Well, there are some results you're responsible for. So don't fall into the trap of not being attentive to results. You need results-oriented goals at least every 90 days that keep you accountable as to whether you're functioning. If you look at corporate teams and how they function and what they identify as their problems, 2/3 of them say that avoidance of accountability is their number one problem. But believe me, you can't start at accountability and say, I'm holding everybody here accountable. If there's no trust, they'll just shift blame. You can't substitute it. You have to start at the bottom of the pyramid and trust. Well, how do you get the people to say, trust me, trust me, trust me? Show trust in them. If you make a mistake, own up to it. Be accountable yourself. Be committed yourself. If you need to have conflict with somebody, pull somebody aside and say, hey, I care about you. I value our relationship. This was troubling to me, and I want to share my concern with you because I want our relationship to grow, and I don't want to be resentful or thinking. I want to clear this out of the pathway of our relationship because I value, and moving forward, I want us to have a clear path of communication. So can we quarantine this issue and deal with it so that it's not affecting me in our relationship? There's a way to frame that conflict that leaves a person feeling valued and thankful that you came, rather than that they had excrement poured out upon them. All right. People who don't trust conceal their weaknesses and mistakes from one another. They hesitate to ask for help or provide constructive feedback. If your team is hiding deficiencies from you, you're in trouble. They hesitate to offer help outside their own areas of responsibility. That's not my job, is what people on teams that have trust issues say. They jump to conclusions about the intentions and aptitudes of others. Well, that's what she meant when she looked at me that way. She may have had a bad meal and she may have GERD and have reflux or something. It doesn't, I mean, open communication flows from trust. Jumping to conclusions follows from loud. Fail to recognize and tap into each other's skills and experiences because we're siloed. If I've got to protect me, then I need to make darn sure that you're not cross-trained in my job. So if I go down, that you could take my position. If I don't value my contribution to the team, I need to make sure that everybody else looks bad or that everybody else is ignored. It takes a great deal of confidence to deflect praise onto others and to lift up others in cross-training. People who don't trust each other waste time and energy managing their So when people don't trust each other, they waste time and energy basically posturing, making sure that all their behaviors are managed for effect rather than actually getting the effects that the team needs. They're wanting to look like they're busy rather than actually being busy. They hold grudges and they dread meetings and find reasons to avoid spending time together. We all need to have work-life balance, and your team may socialize, your team may not socialize. Obviously, there can be challenges involved with socialization, but I'm not really talking about after hours here, but after a meeting, if your people don't linger, that's a problem. You don't want them to linger because they're talking about the stuff at the meeting and actually having the conflict that they should have had during the meeting time, but you should hear them talking about their kids, their pets, other stuff that's happening. Your team should enjoy being around each other because they value the work that they're doing together. Members of trusting teams admit weaknesses and mistakes. They ask for help, accept questions, input about their areas of responsibility. They give one another the benefit of the doubt before arriving at a negative conclusion. They take risks in offering feedback and assistance. It is risky to give people feedback because they might blow up in your face. If I come to someone and say, hey, your performance is good, but it could be better if you did this. What might we do to help your performance? And then I'm afraid that they're going to attack me with, I don't like the joke you told 3 weeks ago. You have to trust people with feedback, especially in cancel culture. People have to trust one another to give negative information in the workplace. Trusting teams appreciate and tap into each other's skills and experiences. They focus their time and energy on issues, not office politics. They offer and accept apologies without hesitation. I'm sorry. How can we do that better? How can I avoid that in the future? And they look forward to meetings and spending time together. People who fear conflict, as we said, they have board meetings. Back channel politics and personal attacks are more important than the issues of the team. They ignore controversial topics that are critical to team success. If there's a low performer on the team, people will cover that up if they fear conflict because the work of the team is less important to them than just avoiding conflict and protecting themselves. Whereas if people trust each other, they'll actually approach low performance issues and deal with it. And you'll find that that's a 360. It doesn't have to come from the top. It doesn't even necessarily have to come from the team leader. And it's not backstabbing. It's honest assessment of who needs to improve performance and how can you assist them in that performance. And good teams will try to rehabilitate a weak member or a weak performer without casting them out of the herd. But they take pride in the team enough that if there is a low performer that's actually affecting the performance of the team and they don't respond to feedback, then they will actually want you to move on from that person and get them in a new position within the company or be terminated in terms of employment altogether. You can keep weak performers or you can keep strong performers. You will not keep both because if people are consistently having to do the work of others, they'll find another position, and your strong people will leave you if you don't take care of the weak members. And hopefully that's through training and feedback so that they themselves become strong performers, but you have to deal with it. Tap into all the opinions and perspectives because the reason is, if you fear conflict, you don't tap into opinions, and that, of course, leads to a lack of accountability. And then posturing, as we talked about. If you engage in conflict, you have interesting meetings because people say exactly what they think. They should say it tactfully, hopefully, but they do share their ideas. They extract and exploit all the talents of all the team members. They solve real problems in real time. They minimize politics, and they put the real topics on the table for discussion. Teams that avoid accountability create resentment among team members who have different standards of performance. If somebody's seeing 12 patients a day and somebody's seeing 6 consistently, that is a problem. If the 6 patient a day person has a reason that they can't see 12, then that should be taken care of in terms of compensation, recognition, and FTEs. You have to make things equitable. That doesn't mean you make things equal. Folks, life is not equal, despite what any politician will tell you. People have different skill sets, people have different abilities, people have different energy levels, people have different environments at home that affect how they work. And so that's understandable, but you do have to make it equitable. I'll give you an example from our company. In our company, different team members arrange their work with nurse practitioners differently. And there were some nurse practitioners who were seeing lots of patients and some who were not seeing a lot of patients. And the reason why this was not discovered, it was well known by the staff, but it wasn't known in the C-suite because the physicians and the NPs shared a schedule. And so they might have 30 patients on the books. Some physicians might see 27 and their nurse pracs would see 3. And some physicians might see 15 and the nurse prac saw 15. And so the nurse pracs have wildly different standards that they were expected to perform because the outcomes were hidden because it was all in one shared schedule. I never had that with my MP. And so when this hit the fan, we didn't have to worry about it because from day one, my nurse practitioner had her own schedule because I wanted to know how many patients she was seeing, and everybody can see exactly how many I see because it's equitable. And so if our team performance is not what it needs to be, then we know who is seeing fewer patients and who's seeing more so that we can adjust things and make sure that everyone is treated equitably. Something that sounds very simple, but even in a very highly sophisticated corporation, this is something that happened, and it was an avoidance of accountability. And so that encourages mediocrity. It encourages people staying around the middle portion of the curve and not pushing themselves to higher outcomes. And that's not always higher patient volumes. That's just one metric that I'm using and showing you because that's very simple for us to think about. Avoiding accountability leads to missed deadlines and key deliverables, and it places an undue burden on the team leader as a sole source of discipline. If you have a good team, you don't have to mete out a lot of discipline. They discipline themselves. Sports analogies are great. Coach on the field, coach on the court. One of the reasons why people, and whether you like him or not as a person, one of the reasons that they say Michael Jordan was so successful is that he held the team to a higher standard of discipline even than Phil Jackson did as a coach, because the team valued winning so much, and he as a player valued it so much that Phil Jackson didn't have to do a whole lot of disciplining with his teams because Michael Jordan would do it for him. Same for LeBron James in a very different way, a very different style of leadership, but Mr. James holds his team members accountable. So regardless of how you feel about these guys as community members or whatever, it's an illustration that discipline doesn't have to come from the top. It may come from the team itself. Teams that hold each other accountable ensure that poor performers feel pressure to improve. They identify potential problems quickly. They question approaches without hesitation. They question the process, but they don't jump on the people. They establish respect among team members. Everybody's held to the same high standard. Our meetings are supposed to start on time, whether I'm there or not, because I expect to be punctual. If I'm delayed by a patient, I am upset if the meeting is not started on time. I'm not upset if they start. I'm great. I'm upset if they don't start and they wait on me, because the standard of punctuality is more important to me than my input in the meeting. Because it's very, very important that if we're going to hold our MA or our nurse or our assistant to that punctuality standard, that I need to be held to it too. And the standard is meetings start on time. And if you can be there, great. Otherwise, none of our meetings will ever get done because we're all busy. Things happen. And then we want to obviously avoid excessive bureaucracy and corrective action. Team that's not focused on results stagnates and fails to grow. They're just stuck in the status quo. They're imprisoned in the jello of inertia, and they never move forward. They don't innovate. And in a market economy, honestly, they don't exist. You're at the mercy of someone else's fiat if you're not focused on results. One of the reasons why I've never feared, palliative jobs or whatever, or meetings with the CEO, I look forward to those, is because I know our metrics fairly well, and know how we perform. I know how we perform vis-a-vis other teams. And so I look forward to those comparisons. And so that gives me a tremendous amount of freedom. It doesn't mean that we're always great. It doesn't mean that we always compare favorably, but I kind of know where the flaws are, kind of know where the good points are. And so I know where we need to grow. And that leaves me without fear. And also because our CEO is a great team member, our CFO is a great team member. And so I don't fear that conflict if they say, hey, Clay, we need this to change or that to change, because I know where we are because we've been focused on results. And so when somebody drops the results hammer on us, I'm not worried about it. I look forward to it because we've already dealt with the results hammer. We've been dealing with it ourselves. If you're not focused on results, you're going to get beat. And competitors here may be illness, it may be pain, it may be nausea, it may be a lack of communication. It doesn't necessarily have to be the healthcare delivery system across town. You will lose good associates if you're not focused on results, because good associates are results oriented. And then people will be focused on their own careers and individual goals. If they have a competitive job within a 10% salary range, they will move and leave your team if you're not focused on results. Whereas if you're focused on results and you have a good team, it will usually takes more than a 10% salary jump for somebody to jump ship, because they will stay even at a competitive or lower salary in order to be part of your team. And they'll come to you and say, I've got a competitive offer. What can you do for me? Not trying to hold you hostage, but saying, hey, how can we make my job more interesting? This generation, we bang on the millennials a lot about their values and stuff and their work ethic, but actually it's kind of interesting. A lot of times creativity, importance, and belonging matters more than an extra $3,000 per year. So it's just interesting how you motivate folks and make sure they're valued. Knowing where they fit on that 4-quadrant grid that I showed you at the beginning, that's incredibly important in terms of retention of associates, because if you don't know what drives them, it's very difficult. I'll give you an example. I had a PA and an MP in my private practice for many years. The PA is still with me, the MP is not. And they were both controllers, very strong-willed, very opinionated, very solid women in their early and mid careers. And I'm an affirmer. I just want everybody to tell me I'm great and I'm wonderful and make people feel good. And, so I was giving them all this positive feedback. Oh, you do such a great job. We can't do the practice without you. You're awesome. You're awesome. You're awesome. But I was jacking around their schedules and they hated me. Not me personally. They hated me in the workplace because I was giving them what I wanted to receive in terms of positive affirmation, but I wasn't giving them what they value, which was control of their schedule. Once we did that grid and I figured out who they were in the workplace, I knew who they were. One of the persons I actually grew up with, went to summer camps together. So I knew her very well, but I didn't know that she had that this was the way that control of her schedule was valuable to her. And once I learned that, attaboy, attagirl, that's fine. But once I learned that they wanted that, then I knew how to motivate them and I knew what was valuable to them. And they're both incredible team members for a long time, given high value to the practice. And then the other person's gone on to be a national leader in the Nurse Practitioner Association and has done great and wonderful things. And so it's just a learning issue on my part, because as a young leader, I didn't know that and didn't know how to, because I foolishly thought everybody was like me. I mean, who else would make that mistake? Results lacking teams are easily distracted. If you're results oriented, you retain these good associates, you minimize individualistic behavior, you enjoy success and suffer failure acutely. You don't put it off or kick the can. You deal with it right now in real time. And then people tend to subjugate their own goals and interests for the good of the team. They'll take one for the team, as it were. These are people, they volunteer for holiday work. They if somebody's down, they donate PTO. These are the types of behaviors that you see when a team is strong and trusts one another, and they avoid distractions. So, final thing is how we fail at change. If you haven't learned anything during COVID or the year 2020, is that healthcare doesn't stay the same. I've been in practice 24 years, and honestly, looking back, I think I've had maybe 3 of those 24 years that I did not have a major sea change in the practice. I'm talking about building a building. I'm talking about a practice partner leaving. I'm talking about a major of a healthcare entity, a merger, leaving academics, going into private practice, starting a fellowship. I'm not talking about, we poured new asphalt in the parking lot. I was talking about major changes about 21 out of those 24 years. And so I have learned that if, these are the good old days. I've also learned that, enjoy the good about today, because something will change tomorrow, make it better, make it worse. But the constant in healthcare is that there are no constants. And so how do you succeed at change? Well, change needs to be endorsed by leaders, but if it's not modeled by them, you'll fail at change. And so, hey, we're gonna change, and we're gonna lean into this, and we're gonna do great. And 3 weeks later, the leader is carping about the new ways that, telehealth that we have to do, whatever. That's a way to fail. We got an eagle on the wall with the motivational quote, but it doesn't captivate anybody's vision, and there's no legs on it. The values are articulated, but there's no process put in place to internalize them. We believe in teamwork, but we never talk about how you actualize teamwork. It's just pie in the sky. Nothing ever happens. Disconnected initiatives. Every 6 months we've got a new color scheme we're doing, and a new this and a new that. And we hired this consultancy company for $100,000. We do this, and then we forget about it, and never. So a lot of nonprofits get stuck in this. They have the values retreat at the beginning of the year, and we never talk about it again. So it's wasted time, really, unless you enjoyed the food. You fail at change if you have no critical mass of people, or you're too slow to overcome the inertia of the existing culture. You have to have the right players on the team. But honestly, I'd rather have fewer players than have too many to where we've got inertia of existing culture. I'd rather have the right people in the wrong places than have the wrong people in the right places. So what do you need for your team to succeed? Well, I need a nurse practitioner. I need a nurse. I need a social worker. Well, I don't know. I need those roles to be fulfilled, but I'd rather have a really good social worker than a bad nurse, because people can flex. Obviously, there are certain licensure restrictions, but get the right people and things will go better. It's a Jim Collins idea. Get the right people on the bus. Where they sit on the bus, you can figure out later. Just make sure you got the right people. If you don't realize change within natural work groups or teams, it's not going to work. Change doesn't necessarily follow the org chart. It follows the workflow. If you look at change as nice but not necessary, good luck. You have to change in order to be effective. Things that are not changing, there's one condition where you don't change. That's called death. And then you have to set up processes to measure improvements in your behaviors. Here's 6 questions your team might want to ask, and it may take the life of your team to answer this. Why do we exist? What is our purpose? How do we behave? What are our core values? What do we do? What's our service? And so this third one for palliative care is easy. Tough symptoms, tough decisions. If you don't have tough symptoms and you're not facing tough decisions, you don't need me. Just because your oncologist doesn't want to write 2 Percocet a day, that doesn't mean you need me. It needs to be tough symptoms or tough decisions. That's the core of what I do. How will we succeed? What's our strategy? What's most important right now? That's priority. And those are 2 different things. It might be nice to have all of these things, but what do we need to do right now? I'll tell you, on our team at West, the most important thing right now is to make sure that the excellence in care that we have at our core location of Wolf River is metastasized, pardon the terrible pun, to other locations. And so we're going to utilize telehealth, a negative change necessarily from COVID-19. We're going to flip that into a positive in 2021, and we're going to make telehealth a way that we're going to expand services by adding, we're going to add another APP position, but we're specifically targeting those outlying sites, the other 10 sites that we have, to use telehealth to help patients there. So who needs to do what? So that's accountability. So I've got this great idea about, the app doing telehealth, but how's it going to work? And that's where I fall down as a promoter, evangelist, the salesperson type. Great, let's do this. And so one of our meetings today was, how's this going to work? Where's that person going to be? How's it all going to work out? And making sure that those people, those analysts up there in the upper right-hand corner, those are your friends. They're the people I hate to deal with. They bother the snot out of me because, I've got a great idea. Why are you raining on my parade? But you can have the rain now, or you can have the rain with a patient in front of your face and the CEO asking you why the patient advocate called and this people are mad, or, somebody walks off the job and says this was a poorly planned operation. So, if you're an analyst, be patient with us dreamers. if you're a dreamer, listen to the analysts. They're your friends. They're not your enemies, trying to help you succeed. And so that's just an example of how asking those 6 questions can be very helpful for you. Some of these are retreat items. You're not going to deal with them at the meetings. But I actually pass around these 6 questions at some of our meetings and just have people think about it. And we kind of, we don't just do it once, we do it repetitively to talk about what our purpose, our values, service strategy, priority, accountability are. Obviously, the last 3 questions change more often than the first 3 questions. Hopefully, the first 3 questions won't change a whole lot. How you do your service and where may, but your purpose and core values really shouldn't change over time. Your service line shouldn't change very often, but the last 3 questions may change from week to week. And so these are things that you can continue to focus on as you move forward. Hope this was helpful for you guys. And thanks for paying attention. And if you have any questions, feel free to reach out, and love to explain it. Again, Frank Lencioni is the Dysfunctions of the Team. Pick up any of his books. You'll really like it. They're easy reads in terms, it's not heavy management corporate stuff, but I think it will challenge you, and I think you'll really enjoy it. The first slide on teams, on consulting services, I've just stolen from different consults over the year. I don't know that that's written anywhere, but that for what that's worth. And I think we've talked about that enough, and I gave all the wisdom I had and then made up some stuff that wasn't wise. So that's enough of that. So thanks, guys, for listening, and hope you have a wonderful continued success in treating your patients.